Obviously, before I graduated from medical school in 1980, there was no mention of HIV or the AIDS epidemic or gay-related immune deficiency or anything like that. I felt I was just planning on going into primary care, and at the time also having come out to the local community, I was going to be available for the gay community. One of the things that I did was in my business card, I found an old business card that I published in 1983. And if you look at my business card, look at all the A's are lambdas. Back in those days, lambda was associated with being gay. So that was my subtle way of advertising to the public that I was okay with LGBT patients. Then what happened in 1981 was in the national news, there was the information coming out about a particular infectious disease called pneumocystis pneumonia, and then a particular cancer called Kaposi sarcoma that was affecting homosexual men, and it wound up becoming a very deadly prognosis for people, and people were starting to die fairly quickly within 6 months of a diagnosis or a year or so. I didn't wind up diagnosing my first AIDS case until 1983.
Dr. Robert Brandt, Dayton, Ohio. Hello, and welcome to How to Invent a Virus. My name is Nicholas Wood. I'm a student journalist at Wright State University, and recently I realized something. I didn't know anything about HIV. Even as a young gay man, the most I'd heard about HIV was that it's a virus that can be transmitted through sex, prevented with things like condoms and PrEP, and it took a lot of lives in the 1980s and throughout the AIDS epidemic. And I guess when it comes down to it, that's enough information for me to know how to keep myself safe and healthy, but the story of HIV and AIDS is about so much more than just health. Over the course of the 1980s, over 100,000 people died of AIDS-related causes. It ravaged the LGBT community, as well as large portions of Black and Hispanic populations. It took the lives of several notable artists, actors, activists, and athletes, as well as just normal, everyday people who happened to live in a time when there were little to no treatment options available. It spawned several activist groups, coalitions, and foundations pioneered by minority activists who wanted to affect change in their community and the world at large, and yet today, very little attention is given to the virus. Sure, advancements in treatment and preventative measures have improved greatly over time, making the virus more or less a livable condition, but still, over 1 million people in the US alone are living with HIV, and over 30,000 people each year are newly diagnosed here, many of them young people in minority populations. So the virus hasn't gone away, it's just that it seems people stopped caring. And that's where I found myself, not just undereducated about HIV, but also almost indifferent. But I decided I'd had enough. I no longer wanted to be in the dark about HIV, a global epidemic that remains a leading cause of death worldwide. I wanted to continue the legacy of all those in my community who lost their lives fighting this disease, and all of those who stayed behind and continuously fought for the advancements we've been lucky enough to see today. And so, like the media studies student I am, I decided the best way to approach this topic was through journalism. I wanted to speak with academics, activists, and health specialists to understand more about HIV, how it's spoken about, how it operates in our society, and how we, as a society, have constructed our perception of the virus. Diseases are natural, but epidemics are political. So the way we educate and communicate about the virus is really what makes the virus an epidemic, and there lies the subject I want to explore. I want to examine the ways in which HIV has been conceived and, along the way, find out how to invent a virus. So to tackle a story as big as HIV, I've decided to go back to the basics of my education as a journalist and break the story down into its 5 W's. Who, what, where, when, and why. Today, we're going to be investigating the who. Who is impacted by HIV? Why are those communities at a greater risk than others? And how can we begin to address some of those discrepancies? So, let's start at the beginning. Early in its history, HIV, or human immunodeficiency virus, and the condition it causes, AIDS, or acquired immunodeficiency syndrome, went by a different name, GRID, gay-related immunodeficiency. This was because doctors in the US initially began noticing symptoms of rare and unusual opportunistic infections resulting from a severely compromised immune system, the symptoms of AIDS, in male, gay-identifying patients. Thus, as information continued to come out surrounding the virus, the conversation primarily focused on this group. However, as cases began to rise in separate populations as well, such as injection drug users and their partners and hemophiliacs, it became clear that HIV was much more than just a gay plague. Today, according to the Center for Disease Control, the populations that make up the majority of all new diagnoses are Black and African American people, Hispanic and Latinx people, and men who have sex with men, or MSM for short. Even still, though, there's a lasting stigma that remains around the virus. HIV is a virus that's passed from one person to another through bodily fluids such as blood, semen, rectal fluids, and vaginal fluids. So it's most commonly transmitted through anal or vaginal sex and sharing needles, syringes, and other injectable drug equipment. In the 1980s, and even now to some extent, each of these actions were in some way or another taboo because of their associations with populations that existed on the fringes of society. So pretty quickly there was this severe stigma that formed around HIV and anyone who was impacted by it or even just associated with it, the belief essentially being that if your behavior is taboo and immoral by society standards, then you must not be a good person or someone worthy of sympathy. And this stigma made it a difficult topic to discuss on a wide scale. In fact, former President Ronald Reagan never made any public mention of HIV until 1985, 4 years into the epidemic, after nearly 16,000 people had been diagnosed with AIDS and over half of them dying as a result. So, because of this stigma and a lack of action from the government, the burden of responsibility fell on those populations most at risk to take a stand. National activist groups were established, such as the AIDS Action Pledge, ACT UP, and Citizens for Medical Justice, as well as other local community groups, to advocate for AIDS research, access to treatments, government action, and also simply their right to survive in spite of how society viewed their behavior. One such group that was formed was the Rubi Girls. The Rubi Girls are a drag troupe turned HIV advocacy group based in Dayton, Ohio. I sat down with one of their members, Jonathan McNeal, to talk about some of the work he and the Rubi Girls have done throughout their over 30 years of activism, as well as how he has seen stigma negatively impact members of his community. So first of all, could you introduce yourself, who you are,
Sure.
what you do, and a little bit about the Rubi Girls?
Sure. So my name is Jonathan McNeal, and I have been a Rubi Girl since '97. So the Rubi Girls are a comedic drag troupe who they started in living rooms and attics and just for fun for each other. It was let's do a show tonight, and they'd put a cassette in the player and perform a number with a bed sheet on as a dress and a lampshade as a wig or a hat, and it was rudimentary drag. So sometime in the late 80s is when those home shows kind of started, and then they started kind of one-upping each other and started becoming more and more ridiculous and fun, and they were having a good time with it, and it became a party, and it became like, let's invite people to see this kind of mayhem. And the parties grew and grew in popularity to the point where they were outgrowing their space. People were clamoring into a living room and gathering out on the front porch and peering through the windows just to catch a glimpse of what was happening. So somewhere along that time, bars started offering them space to perform, and that they would pay the Rubi Girls to be there and do a show. And they decided that pay was kind of going against the grain of their of this kind of community spirit and just the fun that they were having. So they decided that they would donate the money. And because AIDS was affecting our group of friends and surroundings and us personally, different places, we decided that the focus was really HIV and AIDS, and that became the initial kind of drive and mission for what the Rubi Girls became known for in the community. And I made a documentary about the Rubi Girls. I was a fan first and kind of followed them around, was a groupie, you could say, and they found out that I was a film student at the time, and they asked if I would start videotaping their shows just for their own amusement. So I was filming not filming the doc necessarily, but filming their shows and taking the camera backstage sometimes and whatnot, and getting to know them personally. And somewhere along the way, Josh, known as Dana Santel, asked me, when are you going to perform with us? And that's really, I'd been waiting for that kind of permission slip the whole while, because I clearly was enamored by what they did and wanted to be a part of that energy.
And what initially made you become a groupie for them? Was it just their performances? Or?
Well, I remember not really taking to drag initially. There was still some internal homophobia going on there, where I didn't want to associate with drag queens. It seemed a little too gay, a little too queer for me. And then when I saw the Rubi Girls, it sparked something different. There certainly were other troupes doing it before us too. I mean, the Cockettes is someone that you probably want to look at. And they were very political and in San Francisco, and then made a jump to even Broadway for a while. But very political, very, beards on and glam makeup on top of that. And, but we certainly were something happening in the Midwest in particular, that wasn't happening other places. This drag troupe, and a troupe of, with a lot of comedy, and then also with a philanthropy attached.
So you obviously grew up in a time whenever the height of the AIDS crisis was happening.
Absolutely.
And what was that like for you?
It was scary. It was a scary time, and different people approached it in different ways, but I was in some ways terrified of sex, and because of the messaging that came along with HIV and AIDS. I was just on this side of not seeing all my friends die, so I'm 47, so people who are in their 50s and 60s saw entire communities disappear. And so I kind of came in with the side of already having some of that educational piece on prevention, but it also came with instilling a fear of sexuality to me. At the time, OIC was a big organization in Ohio for HIV and AIDS, and we would volunteer at their healing weekends, which they needed angels. They needed people to do things throughout the weekend. But it was a weekend where people living with HIV would go to this kind of retreat space and learn different things about treating the illness, things like that. And the Rubi Girls were angels, making sure that meals were taken care of, making sure that we had different assignments and then we'd entertain at some point during the weekend while we were there. And those were life-changing weekends. I remember there was an event or a moment called a healing circle, and it was, you had to close your eyes and you were put in different spaces around the room and assigned different group numbers. And different groups were allowed to open their eyes and go to someone and just touch them. So whether it was just on the shoulder or whether it was a hug or whatever, and the other people were to keep their eyes closed. And I mean, I can't tell you how powerful that was. And it changed a lot of people's lives. And there were so many people at that time who still were, there were people there giving, massages and Reiki, like I said. And people with HIV were so often terrified to go somewhere or to be open about their status and go somewhere for a massage or for, to be touched. So it was really powerful stuff.
Learning about it now is like from someone in sort of the tail end of it, or at least outside of that height of it, it's sort of hard, I think, to wrap your head around the like reality of like what people were going through at that time, like with HIV or just in the queer community or any community affected by
Absolutely. And for so long we were expendable. I mean, the country didn't care that HIV was ravaging the LGBT community in particular. And they didn't care about HIV because we were the focus of the death toll. And it is a more manageable virus now, and like you said, I mean, the younger generation don't necessarily understand exactly what the older folks lived through, but it's still out there and it's still killing people. Less so. I mean, it's like it is more manageable now, but I dated someone just within the last 10 years who contracted HIV and then was diagnosed with a cancer and died. I mean, so it still wreaks havoc on your body in ways that are not necessarily, to your body's detriment. The only person you can trust is yourself when it comes to sexuality. Love yourself enough to know the risk you're putting yourself in and take measures to lower that risk.
There's no universal experience when it comes to basically anything, but especially when it comes to the stories of those living through the AIDS epidemic. However, two words that repeatedly came up in my interview with Jonathan were fear and afraid. Although it never turned them away from fighting, there was so much fear and uncertainty in the communities that were dealing with AIDS, and that was only compounded by the fact that, as Jonathan puts it, many of these populations were receiving the message that they were expendable, at least in the early years. As the epidemic continued and grew into something that couldn't be ignored, it became clear that further action needed to be taken in order to address HIV on a wider scale. And this would require a diverse approach carried out by dedicated individuals who were driven to make a change by listening to the voices and interests of those who had been silenced for so long. Dedicated people like Dr. Judith Arbuck. Dr. Auerbach is a public sociologist, independent science and policy consultant, an adjunct professor in the School of Medicine at the University of California, San Francisco. Throughout her career, Dr. Auerbach has worked in several positions affecting policy and HIV/AIDS medical research. The common thread, though, throughout her career is finding the places where medical research and social science can intersect to find ways to create effective programs to further the fight against the HIV epidemic. I sat down with her to discuss her experiences in this regard and to learn more about her approach toward fighting HIV at a systemic level, from the height of the epidemic to present day. So I guess my first question is, when did you begin centering a lot of your work around HIV, and what initially inspired you to get involved?
So I had a job working for the Consortium of Social Science Associations in 1990, I think is what it was. And at that time, HIV was, emerging as a major epidemic and pandemic. And there were social scientists who had made the case that we really don't know who's truly at risk in America. We haven't had really good surveys of human sexual behavior, adults or adolescents in the U.S. since Kinsey, and even that stuff people question. I can give you details on any of this, but the long and the short of it is there were researchers who were poised to start doing national, probability samples, representative samples of American adults and adolescents that included a lot of questions about sexual behavior as a way to understand sexual health in general, but the main argument in support of doing this research now was around HIV and AIDS and really understanding what people do and who's at risk. And those projects were about to begin when the Secretary of Health and Human Services put the kibosh on them. And basically, it all became this very political argument about whether federal funding should support research on sexuality. And so my organization and me individually became the advocates for that research. And so that's how I connected to HIV.
I feel like there's like a tendency to place the responsibility for fighting like the pandemics and epidemics on the individual from the like administration perspective rather than looking at it from like the systemic thing. Because I mean, I think epidemics are caused by a variety of factors, but like their perpetuation is like a reflection of the systemic issues. So I was wondering if you could like speak a little bit more about some of those systemic issues that you witnessed like play out in like the early years of HIV, and then maybe how they've like continuously drawn out the life of the virus.
Yeah, I mean, there's just almost too much to say about this, and that is precisely what I've been all about, which is to say something like HIV as a infectious disease and then as a pandemic, and same with COVID-19, are fundamentally a virus, but the virus is transmissible, right? It's a virus, and it's transmitted in the course of human relationships and interaction. So you can't just treat it as this lone pathogen that operates on its own. It's transmitted in the course of human relationships. So already you've introduced more than one person in this story. Whole human beings who live together, have sex, eat together, play together, all that stuff. So you've got pathogen transmitted in the course of human relationships, and all the dynamics of those relationships are important. Sex, eating, living, working, whatever. And those relationships with the pathogen all exist in a social context, or social contexts, because they're so specific depending on where you live and who you are. And so my position has always been, we have to look at all of those levels, all of those dimensions simultaneously and equally. It doesn't mean I'm going to be a virologist and talk about the virology. It doesn't mean the virologist has to understand social structures, but we have to respect it. We all have something to contribute to the understanding of how this pathogen emerges and takes hold in people and then societies, and then what the heck we do about it. And that is kind of what I'm all about. That's what I'm trying to explain, particularly to biomedical folks, that you have to look at the social at the same time as you're looking at the biomedical.
Yeah, that reminds me of like something, whenever I was like looking into some of your work, there was an article about like, you said something in there about like the focus of trying to fight HIV shouldn't be to like treat our way out of this epidemic. And I really like that because it's sort of like that community focused, community-based approach that's sort of like, we need to look at the people it affects before we look at how we are going to address it effectively.
Well, that's right, and it's always a question, who's the we? We say we a lot in these kinds of things, all of us do, and I'm always asking, who's the we? And, if you look at a place like San Francisco, or you look at the country of Australia, they're very similar in how they responded to HIV and different from a lot of other places in that the response was very community-driven.
Right. I mean, that was one thing that I found really inspiring whenever like I was learning about sort of the history of like HIV activism, is that groups like ACT UP were like having to teach themselves like the language of medicine and government to try to implement their own sort of like, okay, based on what we know from our perspective, here's how we can address it through your means.
Right, exactly. It was self-education as a way of empowering folks to be able to speak as equals to scientists. And some of this science actually followed community. It didn't lead community because we didn't have the scientific tools early on gay men were figuring out things like how to serosort, or strategic positioning in their sexual relationships as a way to avoid transmitting or contracting HIV. And then eventually that was studied systematically as, are these effective methods or not? But they started with community experience and knowledge and behaviors or actions. So, it's pretty obvious to people like us that all of this public health and science response has to be very much informed by and attentive to what communities are doing. And, the communities are both affected by and are affecting what gets studied, determining as well as, being asked to participate in research. They should be helping to determine what are the research questions, because they know what's important to them and what needs to be known. Plus, they can also say, here's what we know. It's a different kind of knowledge, lived experience, community-generated knowledge and stuff. And social scientists get that, but the rest of the scientific world is a little bit slow and disrespectful.
The fight against HIV quite literally takes a village. The voices, interests, and lifestyles of those living in the communities most impacted by HIV always need to be taken into account when designing approaches towards addressing the virus in those communities. Of course, this is a really complex approach, as technology, communication, treatments, preventative measures, and just our society in general are all constantly changing. But working through these changes, no matter how difficult they may be, is what's going to help lead us to the end of this epidemic. Alright, so there's still so much more to talk about, but I think this is a good place to leave off for now. We've covered who was most impacted by HIV, at least in the early years of the epidemic, and how those groups' associations with the virus shaped the stigma that many people still think of when we discuss the issue today. We also discussed how those impacted communities' interests were incorporated into the response to HIV as the epidemic progressed, and why it is so important to include those interests into the approaches taken toward addressing the disparities in who's affected most on a systemic level. In the next episode, we'll dig deeper into these topics by discussing HIV and the media to find out more about how people's understandings of what HIV was were formed. Once again, I'm Nick Wood with Wright State University, and thank you for listening to this episode of How to Invent a Virus. A special thank you to Dr. Robert Brandt, Jonathan McNeal, and Dr. Judith Arbuck for speaking with me for this episode, and to Dr. Marie Thompson for her advisory support in the creation of this podcast. For more information on HIV resources in your community, such as testing, treatment services, and prevention options, click the link tree in the description of this episode. Thanks!